I think it's a young generation to whom we need to guide. I will ask the first question: how many of you are postgraduate students? Very few. How many are undergraduate students? Almost all. Fair enough. I believe the rest of the people are faculties. Dear friends, I modify or motivate myself as per your understanding and as per your need. First of all, we must know, as Dada has said, we must know what is death. Death is till now what has been understood is death is a circulatory arrest. You get a cardiac arrest, you don't have heartbeat, you don't have pulse rate, you don't have breathing, your skin is dark, its body is cold to touch, you stimulate the body, there is no response, and that is considered as a death. This is true. This is a one kind of death. What has happened in United States way back in Harvard University, there was a neurologist. This neurologist and neurosurgeon both, they work very hard to see that why some patients are having a head injury, we are not able to survive them. And why in other patients, they go home, even though they are paralyzed, even though they have some neurological deficit, but they go home. So they studied very hard. And that is in 1968, they produced Harvard Community Report. And the first time, the concept of brain stem death has emerged. It's not brain death, the correct terminology is brain stem death. Now, even a first MBBS student would tell me what is brain stem. Brain stem consists of midbrain, pons, and medulla. All the vital centers like respiratory centers, circulatory center, and cranial nerves are originating from the brain stem. So when a human is getting a head injury, he can develop a cortical injury, that is the external cortex or maybe the deep endocortex, or he may get a brain stem injury. What are the functions of the cortex? I am speaking and communicating to you is the cortex function. Your listening is a function of the cortex. You are interpreting, you are reading, you are writing, all these are the functions of the cortex. So, when somebody is unconscious, but he is having a spontaneous breathing, he is having a spontaneous circulation, he is in coma, he is not dead. You got the difference between the coma and brain stem death. When brain stem is not functioning because of the trauma or because there is a raised intracranial pressure, the neurons at the brain stem level are dead, you lose your ventilation, you lose your circulation, you lose the reflexes of all the cranial nerves. In short, the patient who is brain dead is intubated because he doesn't have respiration. He requires some other kind of support to sustain the blood pressure also. He is not having any cranial nerve reflexes. The common cranial nerve reflexes which anybody can find out, second MBBS, first term, neurological assessment in medicine, corneal reflex, oculovestibular reflex, right? So these are all gag reflex. You remember all the 12 cranial nerves and try to elucidate the various reflexes which are a part and parcel of a second MBBS education. So, a student of second MBBS can identify a brain dead person. There is no need to go even up to the postgraduate level. That's simple. In my textbook of Estas, one line was written, eyes do not see what brain does not know. If you don't have knowledge, you cannot see anything. The patient is in front of you. You are going in a round or in a clinical side, and then you do not identify that somebody is dead. Now, is it good enough that you elucidate the cranial nerve reflexes? Then how do you check that this patient is having a ventilation on? He's on ventilator, so you will find patient is having breathing. You will find the ECG is working, like monitor is working, so then there is an ECG. So he's alive, his heart is beating. Only thing he feel, you can see him like he or she is sleeping. No movements, nothing is happening. So how do you diagnose that this man is dead? You know the original definition of death, or circulatory death. Person should be cold, black, dark color skin, no heart beating, no pulse, no respiration. Here, heart is beating, respiration is there, but it is with the help of a ventilator. So, you need to detach the ventilator, and that is known as apnea. Once you detach the ventilator, there is no breathing. No breathing means apnea. Right? So when there is, it should be done under supervision. As a second MBBS student, you can't do it. But as a second MBBS student, you can ask your teacher or a senior person, is he dead or he is alive? It's a very important question. Don't hesitate in asking the questions to your teachers or to your seniors. This is very important. We all are afraid of teachers, and that's not a good teacher. We should never afraid of the teachers. Right? So always ask the question and then try to get the test done. Now, the next question is, how do you know that ventilation is adequate or not? It's very important. Like somebody is breathing, but it is a various type of breathing. You go to the third MBBS, you go to neurological case, you find out kind stop breathing, you have a varieties of breathings are there. So the patient who do not have a neurological death still can have some kind of breathing, often it is a kind stop type of breathing. When the breathing is there, you cannot diagnose somebody is dead, but then if you imagine CT scan or MRI or some investigations done, you find a large hematoma in the brain. It's a space-occupying lesion. What happens is hematoma expands if this patient is not operated timely. And once that hematoma expands, there is a rise in intracranial pressure. You know the brain is surrounded by the solid bone, skull. There is no space to escape anything. And once the pressure rises, it reaches above the systolic pressure, then circulatory, brain doesn't get any circulation. Brain gets liquefied, and then the person is dead. So after some time, if the breathing person having a trauma, having a hematoma, if cannot be evacuated, is going to die. So what you need? Explore timely, you require a neurosurgeon's help, explore timely, take out the hematoma, patient may survive if it is operative case. Right? Otherwise, patient is 100% going to die. Once the brain dead is declared, what have to be done? What are the things to be done? So apnea test is to be carried out. You need to learn something about arterial blood gas analysis. You know who has invented arterial blood gas analysis? Go to the Google and find it out. I'm not going to tell all these things to you. But it's a very young person who has found out, like you. Heparin was searched by second MBBS student. Heparin molecule was searched by second MBBS student. Right? So since many things are searched by young people, least you should know what is arterial blood gas analysis. When you have a normal PO2, you have a normal PCO2, means carbon dioxide and oxygen level in the blood is within normal range. The carbon dioxide range is around 33 to 46. The oxygenation is always above 72. Many of you might have worked in, especially senior persons, third MBBS and postgraduate students in a COVID time. We all measure pulse oximeter. You get a pulse oximeter which shows 95 to 100% of the oxygenation. That means there is an adequate oxygenation in a capillary, but not in the arterial blood. In arterial blood, the P, there is a partial oxygen pressure which is around 70 to 100, which is normal. So, when patient is detached from the ventilator, you check the apnea test. You first check the PO2 and PCO2. Also check the pH of the blood. Normal pH is 7.35 to 7.46. So that is normal. You detach it, you wait for 8 to 10 minutes. You know the accumulation of the carbon dioxide in the circulation is the strongest stimulant for the brain baroreceptor as well as the chemoreceptor in the brain. I think this is all physiology. Nothing I'm talking out of the physiology or of the physiology. PCO2 rises above 60 mm of mercury. Still there is no spontaneous respiration. That is death of a brain stem. How simple it is to diagnose? Very simple. Right? Remember, brain stem is a clinical diagnosis. You don't require EEG, etc. You don't require the waveform. These waveforms are detected, they are the function of the cortex. They are not the function of the brain stem. Right? So even though some EEG activity is present, it doesn't mean the patient is survived. If clinically patient is brain dead, he is dead. Now such type of test is to be done by the astute anesthetist, the intensivist, the neurosurgeon, neurophysician, or anybody like a professor of medicine, anyone can do it. It's not like that only few percent can do it. At least those people who are involved in clinical diagnosis of a neurological disorder, they all can do the diagnosis of a brain stem death. For that, you need to have a committee within the hospital. That these are the people, you involve so many people, these are the people who can confirm the diagnosis of brain stem death because they have to sign it. Now, somebody is dead, how to declare it? The family will not agree because the family understands what is circulatory death. What you have understood till death, till this time, is only circulatory death, not a brain death. This is too serious a talk, so I should have one joke also in between. I got a phone call from one individual. He said that, sir, my wife is brain dead. We want to donate organs. I said, what happens? Are manu sambhalti nahi. So that is not brain death. Right? So it's just a joke for a lighter side because I saw few people are yawning. Right? It's very important to have a committee, find it out that who is the brain stem dead, and then report it. The counseling, family counseling is of utmost important. Family should be counseled in a stepwise manner, that somebody who is normal and take the family every time when you are going to test the patient. Right? Not only for declaration of brain death, for any treatment purpose also. Talk to them. It's very important to communicate. Believe. Recently, one of my faculty, pediatric nephrologist's father, he just fall down like that. And there was a sharp object and he had an intracranial hemorrhage at the age of 62. he died because of brain stem death. Massive hematoma, compression on the brain stem, and then he could not survive. My own faculty member's father. And she decided, because she was a pediatric nephrologist, decided to donate the organ of her father. We used the liver, we used the kidney. Since age was more than 55 or 50, we cannot use the heart and lungs. We use those organs. And it's important every time, the best of the best treatment was offered to the patient. What is best possible? Our intention is first to survive the patient. But any chance, if he is not going to survive, right, we should think about organ donation. It may happen to you in your family. It may happen to your neighborhood. It may happen to somewhere else where you are going, visiting, in hospital, outside the hospital, anywhere. But concept of brain death is necessary to understand. If you don't understand brain stem death, you will never ever jump into the business of organ donation. One of my classmates, when I was studying in the second MBBS in Jamnagar, I passed from Jamnagar. In second MBBS, we found he was feeling tired. My classroom was on the first floor, and the pharmacology department was in the first floor, and so we didn't have lift in those days. We used to climb, and always he was the last person to enter in the class. Very tired looking, very pale looking. We didn't have much knowledge 40 years back. He had a kidney failure. In those days, the dialysis was also not available freely. When we come to know that both the kidneys of my own classmates have gone, what to do, we cannot me. He died of the disease. No transplant was available freely at that time. Today, there are hundreds and thousands of patients. Maybe one of you could have a kidney failure, we don't know. One of your relatives could have a kidney failure, you don't know. Liver failure. From where? Just close your eyes and think that yes, my father is having a need of a liver or a kidney. What will you do? Look at others, and there is no help. The help will come when we create a system. And what is that system? Everybody pledged into the organ donation program. It's a national program. It's international program. Our data are captured by the government of India, and this data are sent to the WHO, World Health Organization. The World Health Organization, today, we are number 3 in the entire world as far as the transplantation is concerned. However, we are nowhere in first 100 countries also as far as the deceased donor organ transplantation. Everybody is looking at the living donation. Like if my kidney fails, I will look at my daughter, my son, or my wife or my parents. Because there is no system is emerging. The youth of today has to participate in this system, development, establishment. We can guide you. Diagnose brain death. Explain brain death. Explain organ donation. Rest of the things can be done by the experienced transplanting nurse. I'll give you a few examples which are very anecdotal examples. Recently in Surat, a baby was delivered by means of forceps delivery. There was a abruptio placenta, and it was not complete full covering of the cervical os. So they tried, and then there was hypoxic injury to a neonate, newborn baby. Baby was resuscitated, intubated. 0 hour of life, baby was intubated. And 4 days of extensive efforts made. It's very difficult to diagnose the permanent neurological injury in pediatric, especially in neonate. The law is you have to wait for 12 hours or more to diagnose the brain death between the two ethnic tests in a pediatric patient. If neonate is there, maybe 24 hours. The baby was declared brain dead, and parents were conveyed. It was the first child in the family, and it was a brave mother. It was a brave father. They cried a lot, and after 10 minutes, they signed the paper of donation. This is what is happening in this society, and we are here to understand that a proper explanation, even to the newly born baby, where the parents are highly attached, they can sign. There's several such examples in my life. I used to go to Surat very frequently. There was an incident where the father was having a head injury, and on the other side there was a marriage of law. Father was declared brain dead. 2 brothers, uncle, I would say, they decided we would like to donate. There were 3 brothers actually. One remained with the father, the other went for Kanyala. The society is ready to donate in odd circumstances also. These are extreme examples. We all are human. We need to work on humanitarian ground. We should not be professional. I hate professional work. We all are human. We are doctors. We need to tell the truth. We say Satyameva Jayate. And yes, without fear, we should tell the truth to the patient and to the relatives. It's time to work hard. I wish all of you do your regular study, but keep your eyes open. What is happening in the ward, especially in a trauma center, especially in the neurological injury patient, you can identify many brain dead patients, convince them what is brain dead, promote them for organ donation. If you can't do by yourself, Gujarati mein kehवत છે આંગળી ચિંધ્યમ પુણ્ય. You divert them. We have Dada and his team, there is a Shatayu team, etc. I'll give another example of what Shatayu has done also. Several years back, they distributed one booklet. Even today, I think it's online with you. So, it is like my son was studying in 5th standard in Ahmedabad. I just stay just behind this hospital only, very close by in Sola in the area. My son was studying, and that Charitable organization has distributed that booklet in a school. After reading that booklet, my son came to home and he said, "Daddy, I want to become a donor." Tremendous impact of a book on the mind of a child. It's very important to read and culture your junior generation, your children, your colleagues. And one of you who knows may become the tomorrow's neurosurgeon, neurophysician, or transplant surgeon. Who knows? If organs are available, you go in favor of transplant. transplantation. I will just give one example, this live example sitting in front of you, Dada. I take your permission to tell your story, sir. He had a massive ascites, and one day he was on treatment for about 8 to 9 months in under medical care. Because of the NASH-related cirrhosis, non-alcoholic steatotic hepatitis related cirrhosis, he has lost the organ. You know, liver is a vital organ. You cannot survive if liver is not functioning. You need liver replacement, and that is liver transplantation. You know, hundreds of functions of liver, metabolic functions. All blood flow from intestine goes first to the liver, and then after it enters into systemic circulation. We have only two total systems, one in the brain and one in the liver. So he had a liver failure, massive total hypertension, ascites, to the extent that he had umbilical hernia and that got ruptured. He had massive fluid coming out of these things. And as you grow in medicine, you will learn what is child A, child B, and child C cirrhosis. He had a child C cirrhosis. I cannot give any anesthesia in child C cirrhosis. Madam is sitting over here, she is sitting over here, she can tell. If you give anesthesia, patient will not recover. Patient will die. I have a problem in making him survive. Took a 1 rupee coin and put it in his umbilicus and take it. That's the only treatment I can offer to him. I started medical management till the liver is available. Tremendous pressure in the mind, and you have to work very calmly. You can't express in front of the patient that you are so sick that a single insult to your body in terms of infection, hematemesis, or any other thing, you will not survive. You can't tell that. Fortunately, we got a liver from Sola. Procured organs, came back, transplanted. I pray to God and I pray to Him also. Please give blessing to me that get your transplant successful, because there are several episodes of spontaneous bacterial peritonitis also. Everything was stuck inside. Operation lasted for more than 12 hours. It was an ICU, he came out, and today he is spending a beautiful life in front of you. Why we tell this story? He is not the only patient. There are hundreds and thousands of patients who are getting organ and they survive. They have beautiful life now. So somebody's bad, the other's life starts. Would you like to contribute to that? Answer is yes. Then please register yourself also as an organ donor and also work for the society. Whenever there is a brain dead donor, you think suspicious of it or identify it, inform to appropriate people, they will help you. We don't want to die, any patient should not die, but everything is not in our hand. Who knows? Just to go outside, see the random traffic outside, say hospital, this hospital. Somebody will come, truck will come, or the car will come. You are having a bad accident tomorrow. You may be on ventilator, or you may be on bed or counsel. If you have conveyed this talk to your family member and sign it, and ask your parents also to sign that they should be also the donor in case something odd happens in the life. You never know, unpredictable